Thank you everyone for coming today. My name is Suzanne Feaster, and I'm the president and CEO of Vitalist Health Foundation. And someone's trying to call me, but I'm going to ignore them. So I wanted to thank you all for joining us today. Our board, when we were looking at our budget for our health foundation, said it would really be great if you could get a handle on where the American Rescue Plan Act funds are going, and then see where the gaps are and see how we might help fill the, to address those gaps with a focus on reducing health disparities. So that led to two things. We had a group of consultants that have been working to interview state, tribal, city, and local representatives trying to get a handle on what we know, and some of that is still very evolving. And then we also wanted to partner with Arizona Town Hall to look at and get public input from around the state about what do you see as the important things. This is one-time money. Most of it needs to be spent between now and 2024. In some cases, it goes into 2030, but most of it, I think we will see out the door in the next two to 3 years. So we really, and I will put in the chat, we have a plan. I think I can do that. Yeah, there. The report that we just finished is on our website with a bunch of other resources at the vitalisthealth.org website. So we now have that available for your in-depth reading. But hopefully you've had a chance to look at the fact sheet that we developed, the federal funding to address COVID public health crisis and its impacts. And what we're going to do today, I'm going to turn it over to Pat Norris, the recently past president of Arizona Town Hall, who is a wonderful soul and led us throughout this year and last 2 years, actually. And I'm privileged to be able to participate on the Arizona Town Hall board as well as a volunteer. So Pat, why don't you turn it, take it away.
Suzanne, thank you very much. And ladies and gentlemen, thank you so much for being here today. It's great to see you all, and I look forward to telling you that in person down the road. We have prepared 2 questions for you to address today, and I'm going to read the questions so we're all on the same page, and then we'll spend about 20 minutes or so addressing each question. The key in an event like this is for you to listen with those ears to what people are saying, and then to reflect on what you might have to add or to supplement. We encourage you to stop and think about what you agree on, because what we have found with Arizona Town Hall is that oftentimes we agree, but we spend most of our times disagreeing, at least verbally. So if we can, we're going to ask you to consider what others think, and if you agree, your real hand going up with your thumb up, or if you would like, use your reaction button, depending on your device, at the bottom of your screen. Thanks, Suzanne, for modeling that. And we can see your hand that way. Because, ladies and gentlemen, we are looking for points of agreement or consensus. Now, we're not trying to force you to all agree, because after all, we want to hear from you. So you may have ideas and priorities. So no matter what, we want to hear those ideas, priorities, and thoughts. But if there are points of agreement, that will make this discussion even more powerful, which Suzanne can then use to provide information to policymakers and the like. So the other thing is, if you agree on a point, please participate in the chat room, because we have 39 people here today. And so it's going to be hard to call on all of you. So you may have a comment or a point to raise. Feel free to say it in the chat room, and I'll monitor it, and I will do my best to read the chat comments to the group as a whole, and to remind people to assess the chat room. I would encourage you, if you're comfortable in doing so, to engage your video, because even though we're not in the same room, being able to see people's reactions, their real thumbs, their smiles, they're nodding of the head is really important. So if you can do that, you feel comfortable, I'd encourage you to do that. So that everyone will have a chance to be heard, I'm going to call on you in order. So, and the best way to do this, again, depending on your device, if you go to the bottom of your screen, your Zoom screen, you'll see a smiley face that says reactions. If you click on that reaction button, you will see that it has a raise hand feature. And then if you'll just click on the raise hand, I will see that your hand will go up and I'll call on you in order. Now, let me just make a couple of clarifications. First off, in town hall fashion, we're all on first name basis. And I know many of you, so even though you may have titles in your day job or in your elected position, that's not how I'm going to refer to you. It's all first names. So even though I'm a retired judge, I'm not your worship anymore. I'm just plain old Pat, okay? That's how we're going to do it. The other thing is, I will try and call on you in order, but if someone has already spoken, and for example, Jenny hasn't spoken yet, I may deviate and get Jenny's comment first. And then I promise you, I'll go back and call on you, Lorraine, or you, Ryan, okay? So that way, everyone will have a chance to be heard. I'd also encourage you to follow what I call is the 60-second rule. And this is especially applicable to those of us who are lawyers, because we know we violate this rule all the time. What I have found in events like this is that if you are talking longer than around 60 seconds, you're likely repeating yourself. So just monitor that and give that a thought. So with that, those basics in hand, I'm going to go ahead and start. But does anyone have any questions about the process or the procedure we're going to follow today? I don't see any real hands and I don't see any Zoom hands. So let's go ahead and start. As Suzanne mentioned, with the American Rescue Plan Act and then its predecessor, the CARES Act, Arizona, as well as other states, are going to receive or are in fact in the process of receiving significant billions in one-time funding. Now, the monies may be used over a 2 or 3 year period of time, but once they're gone, they're gone. This is one-time funding. So what we want to talk about first are the major areas that are covered with these funds, and to talk about where these monies should be prioritized. On the fact sheet that Vitalis prepared that was attached to your materials, if you turn to the second page, you will see that the categories, this question is geared to categories. There are 6 broad categories ranging from direct COVID responses, public health measures, which would include, of course, vaccination campaigns, to direct business aid, to then human services, housing assistance. These are separate categories. So the question we want to ask you is, given that this is one-time funding, what are the most important areas to invest these funds to address disparities in our health and our well-being? So with this said, let me read to you the question and then we'll turn this to everyone to address. Arizona is in the process of receiving significant one-time funding, including the American Rescue Plan Act and CARES Act funds. Where are the most important areas to invest these funds to address disparities in health and well-being? And final comment, most important areas, keep in mind, ladies and gentlemen, that if everything is a priority, nothing becomes a priority. So I want you to think critically about where you think we can get the biggest bang for these bucks in address disparities in health and well-being. Linda, I'll call on you first. Thanks.
Thank you, Pat. One of the areas mentioned in the report, which I concur with, is we need to increase bandwidth in Arizona. What we saw, especially in rural areas, is there was a huge inequity, especially for students and workers that were trying to access the internet from their homes and they could not. And it had a very negative effect on students that were able to try to follow their studies or even connect because usually they would go to public services such as libraries, which were now closed. Schools were starting to open Wi-Fi in their parking lots. So I think increasing bandwidth is something that would be a huge return on investment to address inequity.
And indeed, in a couple of different categories, broadband monies are allocated, such as education programs and services. And then also, you'll see that they are involved in direct COVID responses, because as we know, broadband was critical to our communities, the availability of medical care. Ladies and gentlemen, other comments about these categories of funding? Curtis, thank you. And then I see Lori, I believe, and then Tony.
Good afternoon. I'm Curtis, and I run a CSA farm bag program out of a community garden. And what I agree on with the report is food insecurities. I'm seeing a lot of places who don't know how to even use raw food that we put in the bags. So as far as education to replicating business codes, to replicate things like Agritopia, that's I believe in North Phoenix, that have more of a cultural and food stability mindset.
Curtis, thank you very much. Broadband food insecurity. Lori, did I see your hand up?
You just saw my thumbs up for the broadband.
Okay.
I work in adult basic ed. It's a huge issue, not just for kids, but for parents who are trying to get their education.
Absolutely. Thanks, Lori. Tony Smith.
Well, I agree. Broadband is very, very high on my list. In Pinal County, we have a lot of rural areas, and especially an eastern part, and they were certainly very much impacted by the closures of schools. You couldn't even get internet capability to those homes. But there's another item that I think is really becoming quite a very, very serious topic. It has been for years, but we always seem to pass it over, which is mental health. This is impacting our homeless population. They got substance abuse issues, PTSD. It's impacting our families, and it's just an area that we continue to unfortunately ignore. And if there's a way in which we can spend these CARES Act monies and direct them to strengthen our mental health care, I think we would really get a lot of bang for our buck. Thank you.
Tony, thank you very much. For those of us who live in Phoenix, we see so many folks in our populations who clearly are having mental health issues and they're struggling. So that's your point is very well taken. I think I saw an additional hand around the room. Anything else, ladies and gentlemen? We've heard broadband, a lot of buy-in on broadband, food insecurity, and then the point that Tony just made, mental health. Rosanna, thank you and welcome. And then I see Robert. And Rosanna, you are muted.
Yeah, that would work, wouldn't it? My apologies, everyone. Good afternoon. Shelter, I think, is very much something that's very critical. I mean, if you have no place to go, a roof over your head. And I actually, the Capital Times had a kind of a round table. And what I heard today was there is actually funding that is available that is not being used because of all the red tape that's occurring with people that are facing evictions. And not only is it the people that are actually, living in these apartments or homes, but it's the landlords that are actually having challenges as well. So I think that's a priority to actually, the funding is there, but I think more of an educational and I guess eliminating more of that red tape. Thank you.
Thank you very much. I have Robert and then Judith.
Folks, this is Bob Bro, former cluster builder in economic development, one-stop shopping, all that kind of stuff, and town hall member, and we had a meeting up in El Tovar many years ago, and a gentleman from Shiprock came, and I talked about almost the same topic as this. And he says, in one stop employment and stuff like that, that, you go to one place and he said, Bob, you don't understand that there's like 20 or 30%, I don't know what the number is, of our homes don't have electricity. And so, broadband is not of any value. And he was embarrassed to be in there. But his statements later on that week were cited 3 times as a wake-up call to us who are more fluent and understanding and doing it. And I've driven up in that area to go to Four Corners, and 7 o'clock at night in the dusk, 2 boys are walking the street. It would have been for about 2 miles. They had a kiosk and they were selling Indian jewelry. And I picked them up and talked about what their life was and that kind of. And I said, you need me up here. And I said, look, like about a mile. I'll try. No, we walked that. It's normal. They were used to that. So infrastructure is in electricity and in water. So, and then in 98 or so, I fought the state legislatures because the Corporation Commission was going to allow the telephone companies not to upgrade the rural areas. And I made the argument that, folks, we need all of us. We're a state, and Arizona is renowned, and you people here in this committee are renowned for understanding that we serve each other, and some of us are more fortunate than the other. So I convinced the Corporation Commission and the telephone companies that the urban areas, Phoenix, Tucson, Yuma, we would subsidize the expense, and that we would get charged more than the remote areas, just because we need those people, those brains. And after COVID, we need it more than ever. Over and out.
Bob, thank you. On the infrastructure point, indeed, 4.8 billion in the category of direct COVID response. One of the categories, and we'll be talking about prioritizing within each category the particular line items, but is in fact includes investment in water, sewer, and broadband. Now, for those of you who didn't see the fact sheet that I mentioned, it is attached. There's a link to it attached on your invitation to today's program as well. So let's then go to Judith.
Hi, Judith Kagi with Pima County Interfaith. I wanted to, this is sort of I guess a response to what is going on currently in the area of funding for public education and all of the controversy around whether Prop 208 will stand or in all of the tax cuts that have a potential for significantly harming our ability to respond to the needs of K through 12 public education in the future. So I would hope that we are going to have enough flexibility to respond to whatever happens in that arena, because we are so far down in per pupil spending for public education right now. It's disgusting. So I would say anything we can do to shore up and respond to threats to funding for public education would be my highest priority. And I also want to put a thumbs up to Rosanna's plea for housing assistance.
Judith, thank you. And on the point about education, Curtis, Linda, Elliot Nelson, and others, thumbs up. Now, for those of you who'd like to take another look at our question, Tara Jackson, who's actually the president of Town Hall, I'm just past has-been chair, put the question in the chat room. So this is the question we're addressing right now. And then I would also make a point that Terry put in a comment about housing, especially older Arizonans, older adults who need housing. And so she also is talking about the point about shelter that Rosanna made. Any other comments, ladies and gentlemen, about these billions that we're getting, how best to prioritize the categories. I think I have Sarah, and then Curtis, I'll let you have probably the last word on this. Sarah Archer, thank you.
Asher, actually, thank you so much. I want to talk about, I agree with focus on internet and broadband to address all kinds of disparities. My lens is on end of life care, and certainly the pandemic has brought end of life care to the top of the list of priorities. It's reminded us that death can happen at any time in any age, and broadband would allow access to telehealth services, which has become a priority throughout the pandemic and well utilized. We know it works. We also have an opportunity specifically in the state of Arizona right now around our new Advanced Directives Registry, which is being transferred from the Department of Secretary of State to our Health Information Exchange at Health Current. We know that a majority of Arizonans do not have advanced directives that can be accessed easily or quickly by EMS, by emergency departments. We don't know what people's end of life care wishes are. So they may be receiving care they do not desire. There have been new wrongful life lawsuits throughout COVID. So if we can keep people in their homes for as long as possible, give them home and community-based services and coordinated care and navigation through the help of internet and broadband, that would be extraordinary.
Sarah, thank you. I guess I need to get new glasses because you're absolutely right. I mispronounced your last name. Okay. Curtis.
I just wanted to touch base on building up the foundations. We are on projection to be the 5th largest city in the US. I believe that we just announced. And I want to make sure that we're staying in the lines of the United Nations goals for global climate change and stuff like that. And that way we are building the correct way and not the ways that we have been building our infrastructure.
Curtis, thank you. I'd encourage folks that you take a look at the chat room. Jenny mentioned mental health and resilience training for those who serve and work with who are basically first responders. And indeed, that is in fact one of the categories in the health related programs and services category. And then using monies to support education, not to support, I'll just say generally, conduct that is contrary to public health measures. And then, of course, the importance of shelter and reaching out to people who provide support to people who are in mental health or physical distress. At this point, I'd like to go on to the second question. This has been a great discussion. And let me explain. The second question asks you to look at the different line items or proposed funding categories within each broad category and prioritize those. So for example, if you look at your fact sheet, housing assistance is slotted to receive, I'll round it off, $780 million. Within that $780 million, it can go for monetary assistance to low income consumers to pay for, frankly, expenses that they incur in living in a home, drinking and wastewater, sewer and water. Mortgage and utility payments is another category. Homeless assistance and supportive services, including tenant-based rental assistance, affordable housing development, and non-congregate shelter units. And then payments directly to households that are experiencing income loss and thus can't afford to pay their housing expenses. So those are several different items within that one category of housing. So this question is designed to ask you to say to our policymakers, if you listen to me, here's the number one or number two areas I would say put the money here first before we spend it in another category within this broad category. So let me read you the question. And Tara's also put the question in the chat room. Consider the specific areas noted in the American Rescue Plan. And again, there's education, human services, housing and health. Consider those broad categories. What should the priorities be for utilizing this one-time funding for these areas? Broad categories, but what are the priorities within these broad categories? So for example, within the direct COVID response, 4.8 billion. Should it be vaccination campaigns? Should it be monitoring for the spread of the virus? Should it be medical services for people with long haul COVID? What about premium pay to essential workers? We know that they are worn out and they are tired and they are stressed. Or investment in water, sewer, or broadband? Which should come first? Curtis, I thought I saw your hand up.
You did. I'll come back.
Okay,
I'm
thank
still
you.
reading.
Housing, Terry has commented, is housing should be a priority as it is the foundation to the others being able to be implemented. Then Eileen suggests priorities. 1, education. These are comments in the chat room. 1, education. 2, human services. Terry then also says absolute premium pay for essential workers. All essential workers should at least be earning a living wage. Curtis, I'll come back to you now.
Yeah, I agree with those two. Education, health, and living wages are probably the top 3 for me.
Tony emphasizes broadband, and then of course Jenny says vaccination campaign first. If we don't get this under control, the other issues will be ongoing and worsen as more and more people are impacted. And Jenny, thanks. I see your thumbs up on that as well. John has a comment in the chat room about additional funding for the ADOH, which is the Arizona Department of Housing. A homeowners assistance fund would be a sound investment. Good stewards, they know what they're doing, and people need housing. And Rosanna, I think I see your hand up in the middle of the Grand Canyon there.
Yes, thank you. I appreciate that. In regards to the Arizona Hospital and Healthcare Association actually came out with a press release today, and what they indicated on there is that our hospitals are getting very crowded. So I agree with the comment regarding vaccinations, education, being able to get people, I guess, get vaccinated, which is I know it is a challenge. But however, to assist with any businesses, schools. And so I believe getting healthcare under control, first and foremost, is very important. However, we as a society, we do need shelter. We do need, to be able to pay our bills. So I agree with everyone that has spoken already, but I believe healthcare is a priority right now so that we can take care of the rest.
And indeed, Judah says vaccinations, then education and housing, in that order. Okay, other comments, ladies and gentlemen, insights and ideas. Think creatively. Curtis, you have an additional point, please?
I want to touch base on that healthcare thing. In my opinion, if we were to teach a society how to eat better, exercise better, give them the time that they would need to do all those things, because coming from myself, I'm a veteran, and I take my time to work on myself and all the things that I need to do, and it's a lot of time. It is a lot of time. And I think that going on her point of healthcare, that it is important that people know what the right and wrong things are to do with your health. You know, so education with health is important, in eating right and stuff like that. And if you have these insecure foundations where all these are taken advantage of, or, you know, falsely advertised, you're going to end up with what we're seeing today.
Curtis, thank you. A number of you are participating in the chat room, and as I quickly scan the chat, it strikes me that there is quite a bit of buy-in around the room on the importance of public health measures, specifically vaccinations, mask mandates are getting people to mask up and to treat everyone as if we're living the golden rule for everyone. And so that seems a number of you have made that point. And then you've also seems like there's an awful lot of agreement in addition to public health measures, vaccinations and the like, housing that we've talked about, and then dealing with food issues or food insecurity. Sarah?
I would just build on that vote for public health measures in that, and looking at root cause. So in terms of educating, whether it's about vaccines, whether it's about what do you want in the last years of your life, which now we know can occur at any time for anyone, that's been emphasized. It comes down to healthcare literacy and public service announcements and campaigns, and also broadband. So how do we deliver that message to unique communities and address disparities and improve health literacy and understanding of the message? How do we even know how we're delivering the message is the way specific communities want that message delivered? So I think we have some work to do in terms of some focus groups going to disparate communities' tables rather than trying to bring them to our table to reach out and find out what works best.
Sarah, thank you. And I see that Jenny was nodding and had a thumbs up in agreement, and others did as well. This year and last year, Arizona Town Hall partnered with Vitalist, and I want to do a big thank you to Vitalist on the topic of creating vibrant communities. And I would encourage you to go to the Arizona Town Hall website and look at the report that Vitalist essentially authored. They were the laboring oar and the little engine that could. They were all of that on this report. And one of the key points, Sarah, that came out is it is important to hear from the local communities. It's not a time to lecture them about being vibrant, but is to hear what they have to say and what their priorities are and where they view the needs and what their needs are and how best to structure to address their needs. And we've been top down for too long, and we need to be bottom up and have a sense of humility about what we're hearing. So Curtis, I saw your thumbs up on that. Alex from Town Hall has put into the chat room a link to this report, and I would encourage you after we're finished today to take a look at it. It addresses a number of the, basically what we're discussing are the social determinants to health that frankly we know exist in our communities and cause these disparities because they're not working. So we need to address these social determinants to health. Ladies and gentlemen, other priorities that you would identify within the particular category. For example, one of the folks in our room today in the chat room said, look, education is important, but before I would go to all of these line items in education, I would increase funding for K through 12 and also our Title I schools. That's where I would put the money first before going into other areas. And then also we have some more information in the chat room with links to the Vitalist website as well on their plans and on the use of the American Rescue Plan. Other comments? Well, as folks take a moment to just think about this, Suzanne, I'm going to turn this back to you, just perhaps for some additional comments about what Vitalist is using this information and how it will use this discussion going down the road. And then if we have a little bit of time left, I'll ask if there are any further thoughts by the participants, and then I'll turn this over to Tara Jackson for a few words from Arizona Town Hall, and then we'll say goodbye and wish you to be safe and sound as you go through the day, the week, and the months.
So I would encourage you to take the last few minutes to put anything else in the chat, because we're recording that and we'll take those notes as well and incorporate them into the feedback. Really what we will be doing over the next year is trying to make sure people understand what their elected officials are doing with the money. So for example, Pima County just came out a couple weeks ago with their listing of what they wanted to do, and all of the state agencies, the cities, the tribal entities, and the counties have to report or submit something to the federal government. I think it's Department of Treasury, the end of August. So next week. I know that's hard to believe, the end of August is next week. But and so we'll be looking at those reports and trying to pull ideas out of them. And then we'll probably be conducting a series of webinars that will talk about how specifically do you incorporate and reduce health disparities through housing, through food insecurity, by addressing some of the problems in education. So some of the very things you've brought up, and really talking about the intersections between those. We have elements of a healthy community, which is in a wheel, and we talk about the interrelationship between them. You can't just focus on healthcare or housing or transportation or even social justice. You need to work at them in concert and have that interdisciplinary discussions we think are the most fruitful, so that you aren't just limiting, because, for example, in the education sphere, if young children don't have enough to eat, you trying to just focus on third grade reading when they don't have stable housing or they don't have enough to eat, it is almost futile. So we could pay teachers all the money possible, but if the kids aren't in a safe environment, either at home or in there with enough food, they're just not going to succeed in the way we want them to. So it's looking at those interplay between those various issues. And so one of the things we've been talking about with counties and cities is really forming an interdepartmental task force. If you think about those of you that are related to a city government, the even homelessness, it hits the police, it hits fire, it hits Parks and Rec because people are sleeping in parks. It hits human services, it hits housing, it hits the library because people go in to seek shelter in libraries. So having all of those groups even in city, the departments talking to each other about how to address it can really energize and braid some of the funding. So that's what we'll be looking at and sort of providing additional best practices as examples for local and state government to take advantage of.
Suzanne, thank
Go
you very
ahead.
much for those comments. And I would also encourage you all, before we say goodbye today, to take another look at the chat room. Your comments have been so insightful. The importance of housing, getting help to our kids, advanced directives, as Sarah points out, where a parent has died from COVID, what happens to their children? The importance of public safety protocols, to really reemphasize them. I'd like to thank, as we wrap up, two people behind the scenes who have been doing a lot of work today. One is Mary Greer, who is a longtime town hall volunteer who's been listening very closely to your discussion today and taking notes so that we can memorialize these discussions and your points so that they can then be used by Vitalists. And then I'd like to thank Alex Sadil and also at Arizona Town Hall, who put this program together and did all of the laboring or with links and RSVPs and registration. And she makes the ship of state move forward. And we appreciate that. And then I'm going to introduce or reintroduce Tara Jackson, who's the president of Arizona Town Hall, for some concluding remarks. And then we'll say and send you all on your way. Tara?
Thanks so much, Pat. And I apologize. I seem to be having technological issues with turning my video on. It came on for about a split second and went back off. So I want to thank Pat, who's been facilitating and helping to lead these discussions, both on this particular topic, as well as the Creating Vibrant Communities topic throughout the state. And I am actually at the Arizona Planning Association Western Conference with Mary Greer. And what I wanted to add to the discussion you had today is that one of the programs Mary and I were a part of this morning included people not only from Arizona, but from many of the Western states, Alaska, California, New Mexico, others. I found it very interesting that some of the same topics that all of you are bringing up are the exact same issues that are coming up in these other states. Broadband internet access to those who don't have access, and how to reach both rural and tribal populations who don't have those options, and the impact it has on having communities that are vibrant and thriving, and the need to address those. The other aspect that I find very interesting that's been coming up repeatedly in the last several months, which did not come up when we first started having these conversations on creating vibrant communities a year ago, is housing. And that has come up today, and it's been a part of a lot of discussions we've had. So the last thank you I want to give that Pat didn't already mention is really a thank you to all of you, and for giving us this insight, taking your time away from, I'm sure, your busy days, and helping us to do what we can, working with Vitalists and others to try to solve these problems and bring light to where the issues are. So thanks again to all of you, and I hope to see you at one of our upcoming programs.
Take care all. Stay safe.